All right, good evening, everyone. We're going to go ahead and get started. I'm going to turn this session over to Misty Palmer to get us started on the healthcare career exploring options with Advent Health.
Good evening, everyone. My name is Misty Palmer, and I am a medical laboratory scientist with Advent Health. My current role is in workforce development, which means that I am able to share all of the opportunities with young people that there are for careers in healthcare. Just wanted to bring your attention over to the screen. If you see those three pictures that are over to the side, these are actually Pasco High School students that are enrolled in our Advent Health Explorers program, which meets once a month in our local hospitals to explore the different careers that are available. We will be admitting new students in September. So if that is something you're interested in, you'll see an email address down here on the screen for Healthcare Exploring at Advent Health. Please feel free to reach out. I also have my email on here. I am available to you for any and all questions, and I will get you to the right people. So please feel free to do that. So why Advent Health? I just want to tell you guys a little bit about our company. I have been an employee of Advent Health for 20 years. Over several of our hospitals in the Orlando area. And then I was also in one of our Texas locations. And then I came back here to the Tampa side to run another laboratory when they opened them. So, I know a lot about this company, and I can tell you a little bit about why it's so special to me. We have over 100,000 team members. We are in 9 states. We have over 300 medical offices. We have about 54 hospitals right now. It's always changing. We recently just opened a hospital in Port Charlotte, so very excited about that. And another thing that makes us unique is we actually have our own university. It's a private faith-based university called Advent Health University. And this university was specifically created in 1973 to produce graduates in the areas that we need in our hospitals. So we work very closely with Advent Health University and all of our talent needs. We are a faith-based organization. Our mission is to extend the healing ministry of Christ. I bring that up because that's a huge part of who we are. It is woven throughout our entire system from the top to the bottom. So you will definitely feel that in any one of our hospitals. We have a commitment to hire new grads. So Forbes actually gave us an award for the best employer for new grads. We believe strongly in pouring into our next generation of healthcare professionals. And your education is super important to us. So we have a dynamic learning community. We are focused on creating that curiosity in everyday life. We have a leadership institute in our hospital specifically for creating our next healthcare leaders. And I mentioned our partnership with Advent Health University. We have educational benefits that are really unparalleled. Not only do we reimburse you for traditional educational opportunities, but we direct pay them to many schools. They send me a bill and I send them the money. It never even reaches the student. I'm very proud of that. We also have workforce development programming. And think about this as education that happens in the hospital. So you will have bookwork, you will have modules that you do, you will have an instructor, you will be doing patient care to master competencies, and all of this is done in the hospital. You are paid the entire time that you're learning to then get upskilled to do a new job to get paid more. So that is really what I have worked very hard on in the past 2 years, in making that the normal thing that people should expect. And something else that kind of sets us apart is we believe very strongly that every one of our team members is mind, body, and spirit. And so we know that work-life balance is huge. Mental health is huge. Our team members have very active, full lives outside of work. And we're committed to honoring that. And I think that that's super special also. And that's where all of the 40-hour work week education comes in, where you're not doing that in your own time at night. I like to say you're not missing your kid's soccer game, though that doesn't apply in this audience. It applies in a lot of audiences. I was that 25-year-old with 3 kids that worked from 7 p.m. to 7 a.m. so that I could be a stay-at-home mom during the day, and then was getting my master's degree on top of that. So I like to think that we've evolved to a place where we're really caring for people holistically. So I'm going to take some time to just go over a few careers. There are many. We have an Advent Health career guide. If you drop your email in the chat, I will be happy to send you the digital version of that career guide that was specifically created for high schoolers. And this will give you a little more, much more careers than I'm going over right now. I am going to split up these careers into what I call the entry point, right? And it's the first place that you touch the hospital, the educational level where your career starts. It doesn't mean that's where it ends, and it definitely gets built upon, but this is the place where you first have that professional entrance into your career. So we'll start at certificate level careers. So these are careers that do not require a college degree. Some of career certificates take a year. Some of them take 3 months. It just really depends on if you're doing it full time and how much you're putting into it. So the careers that I would like to highlight at a certificate level really is our surgical technician. Surgical technician, these are the people in the hospital that are in the operating room, really, that are setting up the room, right? Making sure the patient is draped properly, making sure that all sterile techniques are followed in the operating room. They are assisting the physician with all of the equipment that they need to do the surgeries that they need to do. They are also assisting with some of the procedure. So this is, again, a certificate level course. It usually takes about 10 weeks 10 months at a technical school. We, however, are launching our very first in-person, on-campus surgical technician program at Advent Health in June. So this is where we are going to be taking people with no experience right out of school and training them on the job and paying them the entire time and paying for all the educational material. And it takes about 5 months. So at the end of those 5 months, you can become a certified surgical technician, and you can see the salary there. I look at that salary and I think that that's a darn nice salary for not having to have a college degree. So I look at surgical tech as a really way to get into the OR if that's something that you think that you want to do. Remember, it doesn't have to be a stopping point, right? There is a full career ladder in the OR that goes from surgical technician into that associate level surgical technician with more responsibilities and more pay. That can be built on to be something called a first assist. And that's actually the person, that's an associate's degree. And it's the person that sews up the patient, really. That can be built on to an RN role or a nurse anesthetist role or a certified anesthesia assistant. And that can even lead to, a medical career as a physician. So I highlight that career because I think that it's not for everybody, right? It's the OR, you got to know what you're getting into, but it is a great place to start. If you are interested in direct patient care, particularly the nursing service line, something about nursing is that you're going to have a few patients a day and you're going to be with them all day, right? So that's that really intimate relationship, caring for another human being during your entire shift. If that is something that speaks to you, we have a patient care technician role, which is really like that assistant to a nurse. This is, again, a certificate level program. And we know that Pasco County Schools actually offers that in our schools. So love that. We have a laboratory assistant. So if you think about the medical scientist that's in the laboratory that's actually diagnosing cancer, that is actually giving blood for transfusion, this is the assistant that helps them. They also draw blood, so they perform phlebotomy, but they also assist the scientist at what we call the bench. And this is no degree required at all, and we can teach you this 100% on the job. This is a great way to get experience while you're going to school to do something else. So when we talk about an associate's degree, we think of that as being like a 2-year degree or a degree you would get at your local state college or community college. And what most people don't know is that the majority of all of our healthcare careers are at an associate of science level. So that mentality of bachelor's degree or bust really just doesn't have a place in healthcare. These are well-paying jobs that you cannot do with a bachelor's degree. You need an associate of science. There are many people with bachelor's degrees that have to go backwards and now get an applied associate of science degree because they can't make any money with their bachelor's degree. I don't want to discourage anybody by any means for getting that bachelor's degree and going to medical school or dental school. We absolutely need that. But I also just want to take a moment to really impress upon you the need for these careers that are high paying, that don't take as long to get through. We're in a place right now, you might have heard about the nursing shortage. We've done a really good job meeting that need. We hired 700 new nurses last year. Like I mentioned, Advent Health was noted as being a #1 place to work for new grads. But where all the data is taking us right now is really from a federal level, from a state level, is that our associate of science degrees in allied health are where the huge need is right now. And there is because enough people don't know about them, right? They end up being careers that people fall into after the fact. So they end up being careers that you go to school for 5 or 6 years for, when we could have done it in 2.5 if you knew it existed, right? So I really hope that if you take away anything from this conversation today, is that you take away really that knowledge that you don't have to go bachelor's degree or bust. It doesn't mean you don't get a bachelor's degree, but why not start with an associate of science and an applied degree where you can earn a very good living while you are pursuing that higher degree. So that starts with our imaging technologists. We have a huge shortage in this area. There is a national shortage right now in imaging technologists. So again, this is what makes this a little different than nursing, is that you are working with patients, but you're working a short time with a lot of patients rather than working with a few patients all day. So that's a very different day. That looks very different. So that I've noticed when I work with people choosing careers, I find that really leads them in one direction or the other, is that they really enjoy one of those two paths. It starts with X-ray. You can go into then CAT scan and MRI. Diagnostic medical sonography is ultrasound. That's also a very big need and a well-paying career. We do have a program now, which I started a year ago, and I'm very proud of it, is that we are now taking entry-level X-ray technologists. So fresh out of school, 2-year degree, you are doing X-ray, and we are saying, do you want to do CT? Do you want to do MR? Well, the traditional pathway is that you would then go back to school for about 10 months to 12 months in your own time, usually at night when you're working full-time during the day, and you are getting that additional registry, it's called, or certification, to be able to then do a higher level of testing. And so what we're doing at Advent Health is we are saying, hey, let's go, right? We're giving you your 40-hour work week. We're taking you out of your normal X-ray job. We're putting you in a classroom in the hospital for 40 hours a week, 100% paid. We're paying for all of the instruction, all of your exam prep. We're even paying for your exam. At the end of 12 weeks, you take an exam, and it's coming out somewhere between another $6 to $9 an hour, just like that. So that's pretty huge. I'm proud of that, and I think that is a program that we are going to be able to build upon in many different areas in the future. Respiratory therapists. Respiratory therapists are the experts of the cardiopulmonary system. So really think of your heart and your lungs. They are the experts in all things breathing. Breathing or oxygen, I should say, is the #1 drug that is given in a hospital. If you ask people that, they say Tylenol, or they'll say painkillers. Really, the #1 drug is oxygen, and the experts of all things oxygen are respiratory therapists. So we think of from babies in the NICU that are preterm, right? It's working with those NICU babies, really in a specialty. all the way up to those that need mechanical assistance for breathing. And that's where we saw a lot of work during COVID, is really like when you hear people saying they're hooked up to a machine or a machine is breathing for them, the respiratory therapists are definitely who do that. They work with a lot of patients throughout the day rather than just one like nursing, but they work extremely closely with nursing. They are the right hand of nursing, and they have an excellent relationship. Nursing can't live without them, and they know it. So it's a great relationship. And then this is where our registered nurse pops in here. Again, this is an entry point. Registered nurses start at an associate degree. We call them ADNs, or associate degree nurse. You can also be a BSN, a bachelor's of science degree in nursing, but it starts here at the associate level. So really that's that 2.5-year degree about if you need to do the prereqs. If you've done the prereqs in high school as a part of dual enrollment, it's even faster. So really it's again, that nursing job, that's really the heart of that compassionate patient care. And it takes a very special person to do that. And no judgment if you're not that person, because I don't want to be near the patients, but I will take their pieces and parts all day long. So something different for everyone. Right, so this is the bachelor's degree or above. Right here, you see the medical laboratory scientist, and that's me. That's what I do. This is a bachelor's degree in medical laboratory science, or you can have a bachelor's degree in a science such as physics, biochemistry, biology, biomedical sciences, and then you go back for a 5th year to learn the real patient-centered clinical work that is done in the hospital. So, and most of the people that are medical laboratory scientists, they don't get there the direct way, right? They didn't know it existed. They were pushed towards degrees in biomedical science or biology because at one point they thought they were going to go to medical school or dental school, and life happens, right? Life happens. And so then you're left with a bachelor's degree, a very, very challenging bachelor's degree to get, and you don't have a way to make an income. So my laboratory assistants that I hire, I would say probably a good 30% of them have bachelor's degrees in one of these sciences, and they're working next to my high school graduate, and they're working for the same amount of money because they did not know, they weren't educated in that career cycle to understand really how much effort and how much money we need to evaluate that based on the outcome, right? So every career we're going into, what is it going to cost me? How long is it going to take? And what am I going to get in return? And we really need to be educated connoisseurs of careers here. Registered dietitian these are the scientists of food. So if you think about people that have chronic diseases or acute diseases, what they can eat is really dependent on a lot of things. This professional looks at all of those lab tests, right? They look at all of that observation and those physician notes, and they determine what kind of diet a patient should be on based on their clinical symptoms and their clinical presentation. So again, it's really a food scientist, I like to say. It is at the bachelor's level when you walk in the door, but many do have master's degrees. Physical therapists. So I have a special heart for physical therapists. I have 3 teenage sons that are athletes, and we spend a lot of time with the physical therapists. And I will admit that I did not understand everything that they did before really being in there. They're brilliant. They are so brilliant. They can touch, a few paces, ask you a couple questions, and all of a sudden they know exactly what's wrong with you and how to fix it. Now, a physical therapist has to have a minimum of a master's degree, but I will tell you probably at least 50% have doctorate degrees. They have a 7-year college degree. So this is definitely a career that you're going to go to school for a long time. But it's also pretty awesome. I don't know if you've seen our ads, but we are the official doctors for the Bucks, and we're also the official doctors for the hockey team. So physical therapy plays a huge part in that. So Advent Health worked hard to develop a 11,000 square foot experience that was a friendly place for young people to come in and use gamification, use virtual reality, use EKG sensors, all to be able to learn about the different careers that are available in healthcare. We deployed this in Wyoming this summer, but it is on the road, so to speak. We have brought it to Forest Lakes Academy in Orlando. We brought it to the Orlando Science Center, and it will be coming here to Raymond James Stadium in September. It will be available for field trips all day long, which I know we will be there. And then it will also have the availability to be open to the community in the evening so that we can all bring our families out. So I wanted to just give you a quick preview of what that looks like before we open up for questions.
Good morning, team. I know this is a culmination of a year's worth of work by so many team members. So first of all, thank you for all of you who dreamed up this amazing experience. It's a wonderful opportunity for us to be able to inspire others to be able to consider a career in healthcare. We are so excited to invite you into really the very beginning of this entire career experience. 14 months ago, we got a call, and that call was to host as a premier sponsor an experience of a lifetime, engaging the next generation of talent, stepping into the future of healthcare.
We had Pathfinders coming in from nearly 100 countries. We had thousands of clubs represented from around North America, and they all came to Gillette to learn, to experience, to have fun, to worship. Young people were engaged with their creativity. Their minds were sparked with opportunity. They had a chance to experience collaboration. They had a chance to think about health careers in veins that they would have never imagined. So it was truly an exhilarating experience.
We want kids that are here for the Pathfinders, all 60,000 of you, to come through and understand what an exciting career you could have in healthcare.
The career mirror that we did, I didn't know there were other areas that actually opened up my mind that you don't have to do the clinical side, but that you can help with other areas in the overall health field.
Hopefully, it's not like they're going to use it in real life, but if you never know, one day now they have a better idea and understanding what to do.
The second time I got 100 out of 100. Life is about learning, so that taught me something. I was like, wow, I really like this community. I really like the way they treat their patients and things like that. And so it's kind of inspiring. I might actually think of doing either geneticist, becoming a geneticist, or a therapist. It is every word I can imagine of positive. It is energizing. It's compassionate.
The Advent Healthcare Experience was a hit. We heard it from Pathfinders as they came in. We heard it from those same Pathfinders who came back the next day and brought their friends. It's allowing us to get the gratifying feeling of being used as instruments in God's work to get these individuals in the roles that they belong in. So just super excited to have an opportunity to be a part of this. And we can't wait to expand this work and continue to do it in the markets that we operate in.
All right, so that is the end of my presentation, but I am here for all of your questions. Please feel free to ask anything, any direction that I can give you. I would love to.
Thank you so much, Misty. Very empowering and inspirational presentation and just career pathways for our students in Pasco County. So excellent job. And I want to go back. I want to go to Advent Health right now and explore opportunities. So we will take questions now, as Misty shared, and there is one in the chat now, and it's, do you have a specific path for CRNA?
So that's actually, CRNA is amazing. And the reason that I say that is because we actually have operating rooms right now that there are patients waiting to go in, and we can't take them because we don't have enough anesthesiologists or CRNAs. So, and CRNA is a very high paying job. It's very high paying. I wish I should probably look up exactly what it is, but I know they're making a lot of money. So with a CRNA, that is a master's level minimum, and that is a RN, so Bachelor of Science in Nursing, right? And then you go back for another 2 years to do your CRNA. So that isn't something that we can currently do on the job. However, we do have employees that we're paying for that, right? They work for us as nurses, as you know, with that Bachelor of Science in Nursing, and then we are paying for CRNA school.
Beautiful, thank you. Stephanie has a question. Thank you. My daughter's wanting to become a EMT. Can you give any guidance on path or way forward?
Love it. So I thought about including this. There were so many things I wanted to include, but I couldn't do it all. So I'm really happy to have this question. So we are actually hiring our entire EMS service at Advent Health is run out of our Advent Health Wesley Chapel location here in Pasco County. And so we have 4 battalions, they call them. So 4 basically groups of ambulances in 4 distinct areas of West Florida. And the first thing we do is hire dispatchers. And those dispatchers are now being upskilled to EMTs. And I'm very proud of that. So this is again, 100% on the job. We're finding that our dispatchers, which requires no education, right? You can be a high school graduate and become a dispatcher. We're finding that our dispatchers are much better dispatchers when we turn them into EMTs. They can handle that job much better. And along that pathway, in the future, it's looking to now take our EMTs and upskill them to paramedics, which is that associate of science degree. So the difference there is paramedics can give drugs and EMTs cannot, but there's a significant increase in pay once you get that associate of science degree. And that is something that shortly here will be done on the job also. That then is flowing into our RN profession, if that's something you want to do, because we want to have our flight nurses. So these are our nurses that are in the most challenging cases in our ambulances, but also in our helicopters.
Wow, amazing. Thank you so much. Amanda Bright wants to know, is the career experience recap all the month of September, or is it in a specific maybe date or window? And feel free to expand, Amanda, if you want to come off mute.
So we actually don't have a date for it yet. We're still playing around with a few dates for it to come to Raymond James Stadium. But September looks like where it's going to fall right now. It will be a one-day experience. We will set up in Raymond James this experience overnight. We will start in the morning. We will have field trips all day, and then it will be open from usually like a 4 to 6 or 4 to 8 for the community.
Excellent. Very exciting. All right. What else do we have? Other questions for Ms. Misty? I am going to stop the recording, and then we still have 3 minutes, so we can still stay on. Misty's more than happy to chat and offer more expertise and advice towards the pathways. Stop.